Hi, I'm Dr. Mohamed, based in City Clinics in London, Harley Street. So I want to talk to you today about the complications and solutions in hair transplant. So you're going to be able, after this chapter, to manage complications as a surgeon. You're going to be able to distinguish between patients who need urgent attention as well as what long-term effects these can have. So at the end of the topic, you are going to be confident, you are going to be competent in managing these complications. So let's start. So the overview of this topic, we're going to be covering the hair transplant surgeries and the effects like infections, scarring, unnatural hair growth. These are the main topics we're going to be covering, both in beards as well as eyebrows, both again in FUE and FUT. We're also going to be studying about these strategies, so that means implementing best practices and effective management techniques in mitigating these risks. We're going to discuss the FUE and FUT, the pros and cons, and comparing the benefits and drawbacks. Also, techniques discussed are applicable not only to hair, also to eyebrows, beards, with each specific consideration. So the next topic we're going to be discussing is why is it important to be able to manage complication as a hair transplant surgeon. Number one, remember, it's all about patient safety. So you want to ensure that the patient well-being is your number one goal, and you're minimizing risks during and after surgeries to prevent any serious health issues. So for example, you don't want to be coming out of a hair transplant surgery, 2 days later you have an infection then bald, not being treated, you've not recognized these infections, and then patient goes on to have sepsis. Sepsis, as you know, is a very serious condition which can lead to death. So bear that in mind. The other thing you want to discuss and you want to be aware of is the clinical outcomes. So by that I mean you want to be achieving optimum aesthetic results by effectively managing complications to meet each patient's expectation. And finally is your reputation. And again, I can't emphasize the importance of your brand, meaning your whole company's name, including yourself as a surgeon. Yourself as a surgeon being the most important person when it comes to brand recognition, when it comes to brand reputation. You're going to be maintaining clinic standards and fostering patient trust by demonstrating competence and in handling complications. So by the end of the topic, these topics we'll be discussing, not only will you be confident in managing complications, you will also be competent in managing these complications. Okay. So overview of hair transplant techniques. As you know, you've got the two different types, FUE and FUT. So for example, you'll be discussing about a 28-year-old male pattern baldness who undergoes FUE, resulting in minimal scarring and a quick recovery. Alternatively, there's a 45-year-old female who opts for a FUT technique to achieve higher density, resulting in a linear scar at the donor site. As you can see, both have some scars, but now is minimizing those scars. What is the best technique? What is the best way to reduce the scars? What's the right way of suturing the back of the donor area? What level or what size of your punch should you be using to reduce the sizes of the punch holes at the back? Okay. So what is FUE hair transplant? Let's start. As you know, FUE hair transplant is a modern technique where individual follicles are extracted from the donor area, both in the back and the sides of the scalp, and then implanted into the thinning or the balding areas. So this method is usually minimal invasive and it does not require the removal of a strip of the scalp like it does in the FUT. As a punch, a specialized small punch tool is used to extract each follicle. It's also important to understand these are then carefully implanted into the recipient site or the balding site. So what are the benefits of having FUE and the pros of FUE? As we know, number